Have you ever really thought about this? That a tiny change inside your mouth could set off a chain reaction through your entire body? We're talking about everything from your posture to chronic pain. Today, we are digging into a connection that for so many people is just hidden in plain sight. It's the incredibly powerful link between your bite and your body.
So let's just start with a story. This is from someone online, and it's pretty raw. He's talking about how his life got completely turned upside down after getting his wisdom teeth removed. It's a really powerful and honestly a kind of unsettling place to begin, but it's exactly why we need to talk about this.
And you know, his story isn't a one-off. Not at all. Once you start looking, you see this pattern emerge. You find all these stories that point to something big, something systemic happening after certain kinds of dental work.
So what are people actually going through? Well, the list is kind of bizarre and all over the place. We're talking chronic migraines, sudden changes in posture, debilitating pain in the neck, shoulders, and back. TMJ, of course, but even muscle twitching and muscle loss on just one side of the body. I mean, on the surface, none of these things seem connected at all.
And that leads to the huge question, right? How on earth could something that happens with your teeth possibly trigger that much chaos through your entire system? It just seems impossible. But the answer? Well, it's buried in some really fascinating science.
All right, let's get into that science. We're about to uncover this hidden superhighway that connects your bite to your body. And it all starts with just a few key ideas we need to understand.
First thing we need to know is the word occlusion. It sounds really technical, but all it means is how your teeth meet when you close your jaw. That's it. This simple relationship is the foundation for everything else we're going to talk about. And when that occlusion gets thrown off balance, it can lead to this condition: dentomandibular sensory-motor dysfunction, or DMSD for short. This is the clinical name for chronic pain that kicks off because of those dental force imbalances and then spreads to your jaw, your neck, and into your nervous system. So how does that even happen? Well, it turns out your teeth are way more than just tools for chewing. They are packed, and I mean packed, with these microscopic sensors. They're called mechanoreceptors, and they are constantly sending data upstairs about every single touch, every bit of pressure.
So where does all that information go? Well, these little sensors are plugged directly into the trigeminal nerve. And you can think of this nerve as the nervous system's command center for your entire head, face, and neck. It is a massive communication superhighway straight to your brain.
Now that superhighway, the trigeminal nerve, has a really complex relationship with this critical spot right here, the craniocervical junction, the CCJ. This is literally where your skull connects to your spine. And if this area gets knocked out of alignment, it can mess up the signals traveling between your brain and the rest of your body.
And here's the physical link. Your bite, your occlusion, is what directly controls the position of your jaw joints, the TMJ. So any little change to how your teeth meet forces all the muscles connected to it to change what they're doing. And that, in turn, influences how your head and neck are aligned. So now you can start to see how a tiny imbalance in your mouth doesn't just stay in your mouth. Nope. It sets off this domino effect, this cascade of compensations that can travel all the way down your spine. One of the most common things you can actually see from this is something called forward head posture. As the body is just desperately trying to find a stable position to make up for an unstable bite, the head starts to drift forward, and it pulls the entire upper body out of whack with it.
And the physical toll of this is just staggering. For every single inch your head moves forward, its effective weight on your spine goes up by an extra 4 to 5 kilograms. That is literally like asking your neck muscles to carry a bowling ball around all day, every day.
And you know, this isn't just theory. Scientific studies have actually linked specific types of bite problems, malocclusions, to very predictable changes in posture. So, for instance, a Class 2 malocclusion is often seen with that forward head position, while a Class 3 can be tied to a backward head posture.
Now, I know you might be thinking this all sounds a little vague, but this is so far from guesswork. The forces, the imbalances, all the dysfunctions we're talking about, they can be objectively measured with some really incredible technology.
You see, a proper diagnosis is this very methodical process. It kicks off with a detailed physical exam and a deep dive into your history. Then, you've got imaging like CT scans that let doctors see the actual bone structure. After that, muscle palpation helps pinpoint those painful trigger points. And then, finally, advanced digital analysis comes in to measure the invisible forces that are at play.
Yeah, there are tools like the T-scan system that can actually create a map of the forces across your bite, millisecond by millisecond. It shows exactly which teeth are hitting too hard or too soon. And at the same time, other tech can precisely measure the range of motion in your jaw and neck, basically turning those subjective feelings of pain and stiffness into cold, hard data.
So why is all that precision so critical? Well, get this. Research shows that those tiny sensors in your teeth can detect a change in your bite as small as 20 to 70 micrometers. Now, to put that in perspective, a single human hair is about 70 micrometers thick. Your body can feel a change smaller than the width of a hair. It's that sensitive.
Okay, so understanding the problem is one thing, but what can you actually do about it? Well, thankfully, the same fields like rehabilitation and sports medicine that helped figure all this out also offer a path forward to restoring the body's natural harmony.
The approach to treatment is usually multifaceted. It might involve things like therapeutic ultrasound to get blood flowing or low-level laser therapy to bring down inflammation. Other methods, like TENS units, help calm down muscle spasms, and manual therapy can release those really painful trigger points. And often, all of this is done alongside a custom orthotic to basically retrain the muscles into a new, much healthier position.
Because really, the ultimate goal isn't to just chase one symptom, it's to reestablish that harmony between the teeth, the muscles, and the joints. It's about allowing the body to find its natural, stable alignment, starting right from the top.
You know, we look everywhere for the source of our aches and pains. We blame our chairs, our shoes, our beds. But what if one of the most important keys to our body's true alignment has been waiting, hidden, right inside our own mouth this whole time?